Hey, good morning. I'm Vic Senese with UroNurse News. Be sure to like and subscribe. Today we're looking at a novel and emerging approach to a very common and very challenging problem: persistent urinary incontinence after robot-assisted radical prostatectomy. While many patients regain continence within weeks to months after surgery, a significant subset continues to struggle long term. This can have a major impact on quality of life, confidence, and daily function. This study explores whether combining testosterone replacement therapy with magnetic stimulation therapy may improve recovery of urinary control by targeting both hormonal and muscular factors. We'll break down what the research found and what it may mean for future rehabilitation strategies after prostate cancer surgery. This was a clinical study involving 30 men who had undergone robot-assisted radical prostatectomy and continued to experience urinary incontinence. All participants had signs consistent with late-onset hypogonadism, and importantly, none showed evidence of prostate cancer recurrence. Each patient received testosterone replacement therapy for 6 months. In addition, half of the participants, that's 15 patients, also received magnetic stimulation therapy based on patient choice. Before and after treatment, researchers evaluated multiple outcomes: blood hormone levels, 1-hour pad weight test, urinary symptom questionnaires, muscle mass measurements, and importantly, pelvic floor muscle volume using thin slice CT imaging. This allowed investigators to evaluate not just symptom improvement, but also measurable anatomical changes in muscle structure. Let's start with the most direct clinical outcome: urinary leakage. Across all patients receiving testosterone therapy, there was a significant reduction in pad weight, with an average decrease of about 44 grams. That suggests that TRT alone may play a role in improving continence after prostate surgery. However, when we look deeper, a more nuanced picture emerges. Only the group that received both testosterone therapy and magnetic stimulation showed additional and significant improvements in overactive bladder scores, International Prostate Symptom Score, or IPSS, and overall urinary quality of life scores. Even more interestingly, this combined therapy group showed a measurable increase in pelvic floor muscle volume, averaging about 6.3 milliliters, which was statistically significant. This increase in muscle volume was also greater than changes seen in other muscle parameters, suggesting a targeted effect on the pelvic floor structures. Now, from a safety standpoint, an important finding was reassuring. No patient showed a rise in PSA above 0.2 nanograms per milliliter, meaning there was no biochemical evidence of prostate cancer recurrence during the study period. So what do we make of this? Well, the study suggests that testosterone replacement therapy may help reduce urinary incontinence symptoms after prostatectomy, particularly in men with low testosterone symptoms. But the most compelling signal appears in the combination group. When TRT was paired with magnetic stimulation therapy, patients not only reported better symptom scores, but also showed objective increases in pelvic floor muscle tone. Still, the authors are clear: this evidence is early. The sample size is small, and further research is needed to confirm whether these therapies truly work synergistically in a broader population. So for clinicians and patients alike, the study opens some interesting questions. Could we be moving towards a multimodal rehabilitation model, combining hormonal optimization with neuromuscular stimulation to improve continence recovery after prostate cancer? Well, this is one that we'll be watching the results showing up in the future, so keep tuning in to learn more. Hey, tomorrow on UroNurse News, we're diving into a topic that could reshape how we think about prostate cancer risk. The PATROL study is bringing new attention to the role of genetics in aggressive prostate cancer, helping identify which patients may be at higher risk long before symptoms or traditional markers tell the full story. So what's this mean for screening? Could genetic profiling become part of a routine prostate cancer prevention strategy? And how close are we to truly personalizing the risk prediction? Well, I'll break it down tomorrow with what the study found, why it matters for patients and clinicians, and how this could influence the future of early detection and decision-making in urology. For UroNurse News, What the patrol study reveals will be important, so check it out tomorrow.
Thanks for watching UroNurse News. The expert's opinion in this communication are personal and not representative of any organization. They are for informational purposes only, not official guidance. Viewers are advised to use their judgment, seek additional advice, and take responsibility for any actions based on these opinions.